You know, in my particular practice, we see a lot of chronic health conditions, but today specifically, I'd like to talk to you about diabetes. I'll be frank with you, I find in my particular practice that it's very frustrating to work with patients with diabetes. And the reason for this is that I find that people who have it don't really take their condition seriously enough. And perhaps it's just because they don't really understand it. You know, at the present time, I believe the numbers are estimated to be about 27 million Americans afflicted with diabetes. That's both type 1 and type 2 diabetes. But that number is growing exponentially. I mean, it's really becoming an epidemic in this particular country. We'll get more into that a little bit later. But again, the reason why I find it to be frustrating, and I say that I find that people don't take this condition seriously, is way too often I hear where a patient, you know, goes to their traditional healthcare provider and their blood glucose numbers are elevated, and let's say they were diagnosed with it. Simply the answer is just, you know, writing out a prescription drug, usually metformin or a generic version of that, kind of sent on their way, maybe just told to, you know, watch what they eat. And that's really about it. And then the patient continues to just kind of live their life and periodically go for a check maybe once every 6 months, maybe once a year for a blood checkup, to make sure that the medication is keeping their numbers within the laboratory ranges. And oftentimes, you know, when I ask these patients, you know, are you healthy, their response is going to be yes. I find it quite ironic that a person with diabetes could actually consider themselves to be healthy. But I think that's just commonplace today. What I want to do today with you is to try to help clarify a little bit of what diabetes is, understanding the mechanisms behind it. Okay? So let's just begin here. I'm going to use the chart to try to draw out a few pictures for us. Okay? All right, let's just begin with differentiating diabetes. Okay, many of you might know or heard of the two types, type 1 and type 2 diabetes. Okay, type 1 diabetes was often known years past as juvenile diabetes, mostly because it did afflict younger people. In type 1 diabetes, you know, people are taking insulin injections. Okay, basically put, so simply put, in type 1 diabetes, the pancreas, the islet cells of the pancreas are just not producing insulin. I'm going to explain what insulin does in a moment, but I want you to understand that in type 1 diabetes, you're just not producing insulin. Okay, and therefore you need to take the insulin injections. Type 2 diabetes is what we really want to focus on today. All right, because type 2 diabetes afflicts more of us than type 1 diabetes. Type 2 diabetes used to be called adult onset diabetes because it would basically afflict many of us as we got into our latter years. However, those numbers are staggeringly changing. We're finding today kids in their young teenage years are being diagnosed with type 2 diabetes. And let me tell you, it's not just because of weight. That's a misnomer. Yes, it's commonplace to see overweight people developing type 2 diabetes, but it is really not the only cause of why a person gets type 2 diabetes. So let's just discuss this for a minute. What exactly is diabetes? Well, diabetes is a degenerative disease. Now, let me just emphasize that again. It is a degenerative disease. Very often when speaking to people with diabetes or pre-diabetes and I ask them, you know, what is it? I mean, I hear all kinds of answers from sugar allergies to, you know, just dietary problems, or I don't exercise enough, but no one really can explain to me what diabetes is. All right, what are we concerned about with diabetes? Everybody will tell me, you know, cardiovascular disease, and that is true. That is one of the greater risks that we face with diabetes. But really, diabetes, or the name diabetes, is a label that we put on to describe a physiological change that's taking place in the body. All right, so you have to understand, number one, it is a degenerative disease. Okay.